Good morning, everyone. Welcome to the Thursday, December 7th meeting of the Comox Strathcona Regional Hospital District Board. And I'd just like to respectfully acknowledge that we're meeting today on the traditional and unceded territory of the Comox First Nation and the Comox Strathcona Regional Hospital District Service Area includes the Coast Salish, Kwawaka'wakw, and Nuchalnuth territories. And I want to acknowledge all of you who are here in the boardroom in Courtenay today, as well as those who are zooming in from elsewhere in the region and across much of north central Vancouver Island. We have some people here who are new to the board today, and we have some visitors who are going to be presenting as delegations. So I hope it's a productive experience for all. And again, I welcome you. Our first order of business is the adoption of the minutes of the October 19th board meeting. A motion for adoption, please. Moved by Cole Hamilton, seconded by Morin. Is there any discussion? Is there anyone opposed to adoption? Seeing none, that is carried. And our next order of business is a presentation from Janet Bonaguro of the Beaufort Family Health Society to provide an overview of that organization and to make a request of us. So Janet, the podium is yours, and you have 10 minutes and you'll get an opportunity for questions following that. Please go ahead.
Excellent. Thank you so much. This is great. Some familiar faces around the room, and I just want to acknowledge the people who are here today, especially Jonathan, Troy, and Max are probably online, just the support of those individuals who have really helped us to get to this stage. It's amazing what we've done. We have built a clinic in a community that didn't have one. So we're going to tell you a little bit about the story of the Beaufort Family Health Society and the clinic that we've opened called Cumberland Village Healthcare, and a little bit about where we are at in the process. So the society was formed in April 2022, so we've almost been around for 2 years. And in that 2 years, we have done all of the planning, all of the funding activities, all of the operations planning, and we now have a clinic that opened on September 5th. So we have a goal of serving up to 5,000 patients across the Comox Valley. This is certainly not limited to the village of Cumberland. We have actually 6 board directors because earlier this week, I stepped down from the board and took the role of the executive director. So we're excited to see some continuity in the board, and we will be looking for some more board members. We do have representation across the Comox Valley. So we have 4.2 FTEs right now, primary care providers, and we'll be growing. We're kind of hamstrung at the moment by the amount of space that we have, and we're undergoing some capital renovations, which are supported by the ministry and very exciting for us. So lovely board, lots of individuals that you will see in terms of people who are very active in our community. Great board in terms of leadership, the skills to start up a clinic, engage with funders, and engage with the community. So very excited for that. So we will be recruiting at some point. So if you know of anybody who might be interested in learning about community-based healthcare, please send them our way. Our vision is very much to connect people to primary care. We are still in a health crisis in the Comox Valley, and our goal of serving 5,000 patients at the outset, we're partway there. We're at 1,200 patients already, open September 5th. So that's an incredible amount of people taken off the Health Connect registry in such a short period of time. So we're really proud of our providers and the group that we have right now. And our mission is really to create a sustainable network of community-led, community-driven primary healthcare. And this is a little bit different than an island healthcare facility or private practice in that we are a community-led board, an independent organization that hires primary care contractors. And we do want to work interdisciplinary with many other types of providers. So our clinic, Cumberland Village Healthcare, is based on a model where we will have nurse practitioners. We're looking for family physicians, and we're also looking for more primary the primary care network (PCN) staff. So we currently have 1 registered nurse and up to 0.6 FTEs of other resources: mental health, social work, dietitian, and very excited to bring that interdisciplinary model into primary care in the Valley. One of the reasons we created a society to do this is so that we wouldn't lose healthcare in the Valley. We had over 6,000 patients attached to the previous practice owner in that facility. And overnight, almost 6,500 patients became unattached. So almost 2 years to the day that that clinic closed, we signed the lease for the new one. Very excited to have that in place. We know that we'll be in that community for at least the next 10 years with our lease, which is lovely for our community to hear that patients will continue to be attached to the clinic, even if providers come and go. So it's a great model for communities. And if anybody would like to talk to us about our journey and how we've gotten here, very excited to talk to other communities and share our story. And we're certainly going through some lessons learned now as well. One of our biggest challenges is looking at a compensation model that encourages collaboration. So currently our providers are paid salary, which is very interesting, very different than a fee-for-service model, and it incents the providers to connect with each other. So very interesting model. We'll see how that goes. We really want to prove this out and see how this works for the Valley and for our community. We also have a strong interest in evaluation, looking at how this model is actually providing healthcare, how successful it is for our community. And we will be looking at doing some efforts to understand the needs of our community and how well we're serving those. So that's in the bigger scheme of all the other work that's happening in this region around community needs assessment. So some of our challenges: we have high fixed operating costs. We have a lovely purpose-built building, and we are renting, and that means we have very high overhead costs. Because of the model that we've chosen for funding, we have fixed overhead revenue that comes in, and that means we don't have money to really run our society. So all of the funds that we get are driven into primary care and patient care. And we have received part-time funding for a part-time contract executive director, me, which is lovely, for the next 12 months while we figure out a plan to be sustainable for our whole society. So we will be looking at fundraising. And one of the things we'd just like to introduce to this board is when we're a little bit closer to figuring out what that looks like, we would love a letter of support to help us approach other funders as this being a valuable model to pilot in the Comox Valley. Our capital renovations are about to start. I'm very excited about that, and that will allow us to house the remaining 1.6 FTEs that we don't have on board yet. So really, really exciting time for us. And our path ahead, certainly looking at our capital renovations, strengthening and growing the team, including our primary care providers and our board members. We have a lot of work to do on governance and strategy. We've done a lot in the last sort of 18, 20 months, but we're now really through a lot of that planning activity, and we need to shift from a working board to a governance board. And there's a lot of work involved in doing that, a big shift in terms of skill sets. So lots of focus on governance and strategy. And once we figure out exactly where we're going, that funding and partnerships is going to be key. We haven't done this alone, so we're really excited to share the success with the rest of the community and those who have really supported this effort. I'm so thankful for that because this couldn't have happened alone. So looking ahead to that future plan for sustainability, and if anybody has questions, you can reach out to me personally. My email address is ed@cvhc.ca, or you can reach our clinic at hello@cvhc.ca. Thank you. Any questions?
Thanks very much, Janet. We do have questions, and we'll start out with Director Arbour.
Yeah, thanks, Chair, and thanks for the presentation. And this is a project that former Mayor Baird was involved in as well. So, yeah, so I kind of lost the thread because a couple of years ago I was talking with her, and there was a lot of excitement in the community around rebuilding capacity. So very happy to hear that you're fully functioning and moving forward. At this board, we've provided support to numerous rural and small communities clinics, but we've run into a couple of obstacles of late. We were trying to get some of those facilities named, but the process is it's been stalled, I guess. And for me, I represent Hornby and Denman, and so we're very familiar with the community model. And I'm actually going to meet with the Hornby Health Society in not too long here to discuss their issues, which links to yours. So just to be clear, the lease, who is the lease with? Because I know on Hornby, we actually own the clinic, so that really helps with asset management and capital because it's built into the agreement with Island Health. But can you tell a little bit more about that lease?
Yeah, it's sort of our funding model. So the lease is with a private organization, private company, who owns the building, land, facilities, and rents to 3 of us. So there's a clinic, Perseverance, physio, and massage therapy, which is wonderful to have in-house, and a pharmacy. So we have all of 3 co-located. We are renting. We have plans, I think, in the future to look at financial capacity. We would love to own our own facility and do a capital fundraising campaign, but we're just not quite there yet. Yeah.
Yeah, thanks. Anyways, I'll be supportive of any letter of support or anything.
Thank you. Yeah. I will note that our landlord was extremely supportive and held the lease for 2 years.
Wow.
So that we could implement this model in that facility. So it takes a village, literally. Yeah.
Thank you.
Janet, did you want to comment on some of the impediments to getting physicians in the community? I don't know whether you're doing anything related to housing. I know Campbell River has been working with some physician housing, and that's certainly something that's been discussed at the physician recruitment and retention task force here.
Yeah, it's certainly, so those larger economic forces at play, especially in Cumberland, where we've seen more than 20% growth in the last 5 years. It's incredible, and not a lot of housing and some development challenges in our community. So certainly those challenges, I wouldn't necessarily say they're impediments to our clinic specifically, but broader in terms of the Comox Valley. We have found just a general trend that physicians tend to want to work part-time. And that's a bit of a challenge for building a really cohesive team together who is consistently around each other, has that team-based work is available and around to share and collaborate on patient cases. But certainly still have our eyes open. We have a number of leads, but not quite happening just yet. So very excited to have any physicians come through our clinic and talk about our funding model and talk about opportunities to collaborate with our other practitioners.
Thanks. And we have a question or comment from Director Kerr.
Yes, thanks. And thanks, Janet, for the presentation. Congrats to you and the team for all the work. I had a chance to visit the facility recently. It looks fantastic. Just to Chair Hillian's point, mentioning Campbell River's approach with the housing, at the next task force meeting in January, we're going to have the economic development manager from Campbell River come and speak to the task force and kind of provide us with an update of their model. So that'll be interesting, and the invitation will be going out shortly. I guess, my question would be for staff, how possible would it be to add this clinic as our list of rural clinics that we do support with capital funds? Is that a possible thing to do, or what is there a criteria hoop that we have to go through? And yeah, thanks.
Thanks for that. And I'll ask our CAO James Warren to comment.
Thanks, Mr. Chair. Just to confirm, is the question around how to add the Comox Valley Health Clinic? Or did I get that?
Cumberland Village Healthcare.
Cumberland Village Healthcare, to add that clinic to the potential recipients to the rural and so it would take a board motion to add that to the list of those clinics that we are seeking to have named as recipients, as named facilities. That said, as you're aware, the ministry has rejected our application to have those named facilities, and one of their criteria is that the facilities be owned and operated by Island Health. And so that's the barrier that Director Arbor was referencing. So it would be a motion from the board to add this organization. Yeah.
One small comment on that. This is a bit of a new thing. We are, aside from Hornby Denman's Community Health Center Society, we are one of the only other primary care facilities that are a nonprofit society. Everything else is either Island Health or private. So we're finding ourselves in a bit of limbo. So really happy to collaborate to help find a place for clinics like ours in the future.
Yes, and you're also experimenting, as you noted, with a salaried physician model, which we'll all be interested to see. Okay, thanks very much for being here this morning. We will add this item to our next hospital board meeting agenda, and we appreciate you being here today and wish you all the success in your new role.
Thank you so much, and thank you, everybody.
All right, we will move on to item number 2, and I'll invite the representatives from the Comox Valley Substance Use Strategy to present to us. And we have Carrie Hackett, Sharon Karsten, Christopher Hauschelt, and Betty Tate to provide information regarding their recommendations pertaining to the Community Health Hub and to request that the substance use strategy be part of the planning. So I believe they are going to be sharing screens, and we'll turn it over to you now.
While we're putting that together, I'll just thank you for having us today and introduce myself. I'm Carrie Hackett, and I coordinate the substance use strategy. And I'm coming to you from the Lakota speaking peoples.
Great. Thank you, Carrie. Thank you to everyone for inviting us or having us in. Yeah, my name is Sharon Karsten from Walk With Me, and I'm here with Elder Barb White and with Christopher Hauschelt. And we would just like to begin in a good way if we can. We're actually coming in from Kwantlen First Nation, where we've been doing walks with some provincial government ministers, but are really honored to be beaming into Comox territory, which is where the brunt of our work happens. And I look to Elder Barb to welcome us to the territory.
Good morning, everybody. Thank you for inviting us here today. My given names are Wishenska, which means gentle one, Titikam, which means she who brings light into the room. My English name is Barbara White, and I'm a descendant of the Pentlatch people, the Coast Salish people in the Comox Valley. And we're calling in from the Kwantlen territory, grateful for the Kwantlen people to allow us to be here to do our work. And I'd like to welcome you all to the unceded territory of the Comox people, all my relations.
Thank you. Would you like to do a quick intro?
Yes, my name is Barbara White. I'm the traditional knowledge keeper for the Walk With Me team, and I work as a health advocate in the Comox Valley for Island Health and Primary Care Network. I also do other jobs in the Comox Valley, but those are my primary ones. And I'm very grateful to be here today to discuss this project.
Thank you.
Good morning, everybody. My name is Christopher Hauschelt. I am a peer researcher and the operations coordinator with Walk With Me. But more importantly and more relevant to this work, I am somebody with lived experience, deeply passionate about this project, and just happy to see this recommendation being actioned. So thank you for having us.
Thank you. And my name is Sharon Karsten. I'm a community engaged researcher. I'm what's called a Michael Smith Health Research BC Scholar through Vancouver Island University and also through the Comox Valley Art Gallery. Really honored to be here today. So our work today is to present to you the findings from our research report that was just recently released around substance use in the Comox Valley and the need for a community health hub. As a quick summary of Walk With Me's work, we began our work in 2019, really recognizing the impact that the toxic drug crisis and the substance use crisis generally was having on community members in the downtown core. We wanted to know what an art gallery could do to make change. And through that question, we were honored to be gifted stories from many peers, people with lived and living experience, frontline workers, family members. Our practice is to sit in circle and to discuss the stories and to share the stories through walking. And you may have seen us walking through various parts of Comox Valley and Campbell River and other areas with stories that have been gifted to the research and to our process of social change. We've also worked extensively in North Island College, and we are currently contracted by Island Health to deliver 52 story walks, which is the summary of our research in various communities. And we're bringing these story walks into Island Health facilities. We set up a tent outside the facility and bring people out to really meet in a human way and discuss the impacts of the multiple crises we are facing. So just as a prelude, I mean, it's worth noting that around the context in which this research occurs, substance use related harms are increasing in the Comox Valley. We know that there were 37 deaths in 2022 and that those numbers are rising. We also know that Northern Vancouver Island Health Service Delivery area is marking high in terms of the rate of unregulated deaths in compared to the province. Alcohol-related hospitalizations are also increasing. And this top line shows the North Vancouver Island rates versus Vancouver Island as a whole is the blue line, and BC provincial rates of alcohol-related hospitalizations. So we see that rise over time. So our work happens in this context. In 2021, Walk With Me released a report uncovering the human dimensions of the drug poisoning crisis. And our work at that time was really focused on the drug poisoning crisis, but has since really expanded to include the substance use crisis at large. At the same time, the substance use strategy released its phase 1 report. And we together brought that report to mayor and council in the Comox Valley, multiple mayors and councils, and to many leaders in Island Health. From that initial burst of sharing came our second stage work. And this is where we wanted to get more into the details and to map and to really understand the impact that this crisis is having through a gaps and strengths analysis. So this is a research project. It is happening through ethics approvals, through Thompson Rivers University, through North Island College, Vancouver Island University. In the spring of 22, we sat with 50 peers in session and asked about the strengths and the gaps in the local substance use care ecology. We also sat with 25 plus service providers, including, I think just about half of those were from Island Health. And we released a survey and have 50 plus responses from peers that is also aimed to identify these gaps and also the strengths. I welcome you to check out the report. We don't have time to fully detail the parameters here, but I just want to say that substance use, again, is considered quite broadly. It includes in our study drugs, alcohol, it includes cigarettes, unregulated drugs, prescription drugs, inhalants, and solvents, and that the support network is really seen as the network of organizations, entities that are working to support people who use substances. So that includes Island Health facilities, it also and entities, it also includes community. And that peers are people with direct lived experience who have accessed these support services over the past 2 years. So this report called Walking Together was released in March 2023, and we were honored in this work to partner with the Community Health Network and the Substance Use Strategy, who has incorporated one of the key recommendations around a community health hub into its recommendations moving forward. And I'm wondering, Carrie, if you wanted to have a brief moment to describe that process.
Yeah, I mean, it definitely is a process. We're now in phase 3, which is more of an actionable phase. And we have the substance use collaborate up and running. And we are now breaking into action teams, which will address the 21 recommendations. And there are 7 action teams, one of them being the collaborative itself. And one of the actions is a community hub. And so that obviously is why we're here, to ensure that you know what the community has been saying and that we are invited to consult as we go along.
Thank you. And so in what follows, I'm giving patient-oriented research, evidence from people who participated directly in this, of the 50 peers, of the 25 service providers. And so there's actually a number of quotes that I'm presenting today. We won't have time, unfortunately, to read them all, but I do invite you to check them out in the report. And we will just give a summary first of some of the key findings, and then what a vision of what this hub could look like from the community members that participated in our study.
Yeah, so just quickly stressing the gravity of this crisis as it's playing out locally. Unsurprisingly, we were encountering people who had experienced just an overwhelming and significant degree of loss within their friend groups, within their families. Some people losing literally scores of friends within the span of months and years. And one thing I wanted to share as well is that there was a tremendous amount of loss occurring from participants we engaged with. About 10% of the people we engaged with shortly after the release of this report are no longer with us. So this crisis is real and it is unfolding here.
We wanted to draw attention to the stigma that was identified in formal care settings. And I'm wondering, Barb, if you wanted to speak to the stigma that folks described to us.
Yes, unfortunately, we're getting stories about people having trouble seeking services, being turned away for different reasons that we're not too clear on. And the stigma is very real in our hospital services, which is very, very unfortunate and is discouraging people from reaching out for the services. And how can we improve that service to people to give patient-centered care with and reduce the stigma?
If I could just add as well, a significant number of the peers participating in this research identified hesitancy with accessing Island Health as a first line of help and preferred to access community service agencies as the first line and Island Health as a second or third option down the road if community services were not available. There was a sense of a disjointedness in our local care paradigms, especially from peers. We heard that there was a need to tell their story again and again, and that the act of retelling their story to seek services was traumatizing, and that they would be sort of having to go throughout the city to multiple different venues and to retell this story to strangers. And so there's a question about how these services and the translation of the patient-centered care can happen in a way that was more integral. So what can such a hub look like, a community health hub? There was a desire for full spectrum care, really ranging from comprehensive mental health and substance use to things like employability. There is a significant desire that we encountered in the peer community to have employment opportunities. To addictions medicine services and harm reduction, and also abstinence-based services. There was a significant desire for a very strong network and continuum to be developed that would address people, that would meet people where they were at. Do you like to speak to the need for culture that people spoke to in them?
Karen, can I just ask, are you open to questions as you move along, or would you prefer to wait until you've finished?
I welcome, I guess we can have questions. Let's do questions.
Okay, we do have one questioner, but he indicates he'll wait. So pardon my interruption and please carry on.
Okay, and also we would like to see that people have a choice if they want to embed culture into their healing process, and to be able to provide that through the center, to have patient-centered care for people to make choices about how they want to care for themselves. And we find that when people have choices and how they want to care for themselves, it's more successful.
And in particular, many of our Indigenous participants spoke to the lack of Indigenous-centered care and then the strong need for cultural care as part of the paradigm.
Yeah, we were honored to hear from peers that there was a great desire for agency about decisions affecting other peers. People want skin in the game. They want to say at the table about decisions and policies that will affect people with lived and living experience. And you can again reference our report. There's many instances of this.
There was a strong need expressed from both Island Health Service providers and community providers for a more integrated system of care that brings collaboration between these two entities together in a beautiful way. There was some hurdles and obstacles talking about how different teams are operating kind of in silos, and that there was a strong need, especially because many of these agencies, Island Health and Community, are serving the same population, to come together and to really work together on this. One of the examples that we saw that we heard about in our research that we wanted to highlight is the example of the Foundry, which is very specific to youth. But the Foundry has many aspects that are embodying this full spectrum of care, from addictions medicine to employability, and so many other things that I don't have time to mention here, but we do have an example in the Valley that is working. And Carrie, would you like to speak to the Abbotsford Health Center?
Sure. I was a founding member of the Abbotsford Community Hub and the executive director of the anchor agency of that hub. And the hub itself was a very inclusive wraparound care that had sexual wellness teams, mental health and substance use teams, 2 nurse practitioners, infectious disease doctor, on-site pharmacy, dispensing OAT and IOT, healthy aging, senior services, a refugee claimant society, on-site financial aid worker from the ministry, on-site overdose prevention and IOT program, and other medical and social supports, including Amber's employment services, offering employment to our folks. And all of that was accomplished with one intake from a client. And they were greeted in the most respectful way possible. So it was a lot of work putting together grassroots organizations with bureaucracies more, and having shared service agreements and shared visions and all that sort of stuff. So we just want to offer that we do have experience on our team with these sorts of things going forth. Thank you.
So here's our summary and our ask. We are asking Island Health and exploring the concept of a health hub to invite community to the table, not in a way that's tokenistic, but as equal partners, creating a health center that's accessible to those most vulnerable, to those with the most to gain from such a hub. And I'll leave it at that and ask for questions if there are any. Thank you.
Thanks very much. I was remiss in not noting earlier that we do have representatives, excuse me, from Island Health on with us today, as well as, of course, regional hospital district staff. So thanks for your presentation. And our first question or comment comes from Director Grieve.
Thank you very much, Mr. Chair. And I have to say that upon reading the gaps and strengths analysis on this report, this is one of the most moving and heartfelt documents I've read in years. Full disclosure.